Hey everyone, it's Beyond MharzThings, and today we're talking about a topic that can be a little scary for expectant mothers: bleeding during pregnancy. Now, I know seeing even a little bit of blood can be alarming, but the truth is, bleeding during pregnancy is actually pretty common, and in many cases, it's totally harmless. But of course, there are times when it can signal something more serious. That's why in this video, we're going to break down the different types of bleeding you might experience during pregnancy, what's considered normal, and when you should call your doctor. So, let's start from the very beginning of pregnancy. One of the earliest times you might notice some spotting is during what's called implantation bleeding. This happens about 6 to 12 days after conception, when the fertilized egg attaches itself to the lining of your uterus. Think of it like a little bit of redecorating going on. Now, you might mistake this for a light period, especially if you weren't expecting to be pregnant. The bleeding is usually very light, just a few spots here and there, and it shouldn't last more than a few days. This is probably one of the biggest fears for many women when they see bleeding, especially during the first trimester. And it's understandable. Miscarriage is most common in those first 12 weeks, but here's the important thing to remember. Bleeding does not automatically equal miscarriage. Many women experience bleeding during their first trimester and go on to have perfectly healthy pregnancies. However, it's still crucial to be aware of the signs. Along with bleeding, you might experience strong cramps in your lower abdomen that feel different from period cramps. You might also see some tissue passing. If you notice any of these signs, it's essential to call your doctor right away. Now, this is a less common but more serious cause of bleeding during pregnancy. In an ectopic pregnancy, the fertilized egg implants outside of the uterus, most often in the fallopian tube. This can be dangerous because as the embryo grows, it can cause the fallopian tube to rupture, leading to internal bleeding. Along with bleeding, ectopic pregnancies often cause severe pain in the lower abdomen, often on one side. You might also feel lightheaded or dizzy. If you experience any of these symptoms, it's crucial to seek immediate medical attention. Chapter 4: Molar pregnancy. This is a very rare condition, but it's important to be aware of. In a molar pregnancy, abnormal tissue grows inside the uterus instead of a baby. This tissue can sometimes be cancerous. One of the telltale signs of a molar pregnancy is vaginal bleeding that might be dark brown in color, kind of like grape juice. You might also experience severe nausea and vomiting, much worse than typical morning sickness. If you notice these symptoms, it's essential to contact your doctor. Chapter 5: Cervical changes. During pregnancy, your cervix, which is the lower part of your uterus, undergoes a lot of changes. It becomes softer and more sensitive, and the increased blood flow to the area can make it more prone to bleeding. So don't be alarmed if you notice some light bleeding or spotting after sex or a pelvic exam. This is usually completely normal and nothing to worry about. Chapter 6: Infections. Just like any other time, infections can happen during pregnancy, and they can sometimes cause bleeding. This includes infections of the cervix, vagina, or sexually transmitted infections. Along with bleeding, you might notice other symptoms like itching, burning, unusual discharge, or pain during urination. If you suspect you might have an infection, it's important to see your doctor to get the right treatment. Chapter 7: Smoking. We all know smoking is bad for you, and that's especially true during pregnancy. Smoking can lead to a whole host of complications, including an increased risk of bleeding. If you're pregnant and struggling to quit smoking, talk to your doctor. There are resources and support systems available to help you quit for good. Chapter 8: Subchorionic hematoma. This might sound like a mouthful, but it's basically a fancy way of saying that blood has collected between the placenta and the uterine wall. It's more common in early pregnancy and often doesn't cause any symptoms. However, some women might experience light bleeding or spotting. While subchorionic hematomas usually resolve on their own, it's important to let your doctor know if you notice any bleeding so they can monitor the situation. Outro. When in doubt, call your doctor. So, as we've learned, there are many reasons why you might experience bleeding during pregnancy. While most of the time it's nothing serious, it's always best to err on the side of caution and give your doctor a call. Remember, they've seen and heard it all, and they're there to help you have a safe and healthy pregnancy. Don't be afraid to ask questions, voice your concerns, and advocate for yourself and your little one. And as always, thanks for watching. And don't forget to subscribe for more videos on all things health and wellness.